Thank you for joining us to learn about virtual health and collaboration with Microsoft Teams in healthcare. My name is Evan Westenberger, and I lead marketing for Microsoft 365 in healthcare. We have a great session for you today. We're going to start by talking about the Microsoft Cloud for Healthcare. We're going to then dive into Teams in healthcare, and then we'll close out by talking about Teams as a platform in healthcare. So let's get started. I want to introduce Tom McGinnis, CVP of Global Healthcare for Microsoft. Tom's going to dive deep into the Microsoft Cloud for Healthcare and explore what this means for you and your organization. Over to you, Tom.
I'm excited to join you today. I'm Tom McGinnis, Corporate Vice President for our worldwide commercial global healthcare business. As you know, healthcare has been through a massive transformation during the past 6 months. In May, we announced the public preview of the Microsoft Cloud for Healthcare, which helps us and our partners address many of our customers' key needs, ultimately accelerating and supporting this health transformation. I am pleased to announce today that the Microsoft Cloud for Healthcare will be generally available on October 30th. This initial version is targeted toward our provider customers, but following this launch, we will focus our efforts to develop targeted offerings for payers, for pharmaceutical firms, as well as for medtech companies. We know that the needs across these vertical markets are unique, but we also know that they are well aligned to the overall end goal of improving patient and population health outcomes. So, how does Microsoft Cloud for Healthcare help? In this initial release, we focus on the following 4 key areas. Enhancing patient engagement and how we enable data to flow securely through every point of care to continuously improve patients' experience and health outcomes. Empowering health team collaboration. We do this by accelerating health teams' ability to coordinate care in a secure environment and to simplify complex workflow management. Next, improving clinical and operational insights by connecting data from across systems from our partners and creating insights to predict risk and help improve patient care. Finally, protecting health information to support privacy and effective security end-to-end. We also help manage compliance and evolving regulatory changes and improve data governance and trust on a continuous basis. The Microsoft Cloud for Healthcare connects the Microsoft capabilities together in healthcare-relevant use cases like care team collaboration and virtual health. This enables customers like you to connect the data and the applications that you already have in new and transformative ways. These are 2 areas that Christina Baer will dive deeper into later. You are already using solutions from many of our partners in your business today, and our platform helps you connect them together in new ways. Let me show you some of the examples of how these capabilities are connected to help customers like you. The Microsoft Cloud for Healthcare can help you by enhancing your patient engagement with a 360-degree view of the patient data based on FHIR data. As I mentioned earlier, you are already using many systems in your organization, often from Microsoft partners. We can now connect data from these systems and give you access to the most important patient details in a more connected way. And we can also enable you to view care specific as well as historical interactions and clinical data through the Patient 360. Key to these capabilities is the common data model. The common data model for healthcare is based on HL7 FHIR with a direct integration to the Microsoft Azure FHIR service. This ease of interoperability unlocks the EHR data and lets you share it when appropriate with your non-developer employees with the Power Platform suite. We also often hear how customers are trying to build a longitudinal set of patient records. The Microsoft Cloud for Healthcare can give you a full context into the patient's history, from encounters to allergies, conditions, procedures, and appointments, all of which are fed from the EHR data repository in a common data model format built specifically for healthcare. Customers like you have also told us that they want to find new ways to connect with their patients. The Microsoft Cloud for Healthcare can enable you to segment your patients based on their health attributes, their health interactions. This empowers you to build the right types of outreach programs for your patient groups and provide them targeted material based on individual medical record data. And speaking of new ways of interacting with your patients, the Microsoft Cloud for Healthcare also enables patients to start interacting with the Microsoft Health Bot. They can use it to to be triaged for medical decisions, book appointments, and more using Microsoft Health Bot templates. From there, you can even jump straight into a virtual consultation using existing telehealth providers or Microsoft Teams. The Microsoft Cloud for Healthcare enables you to begin the day with a dashboard view of prioritized patient needs and appointments. Your care team members can focus on the right plans that need adjustments directly from the dashboard. They can then see the status of care plans with interactive and actionable insights. We also know how important it is around home health and remote care, particularly in a post-COVID world. Our automated scheduling capabilities can route the right healthcare workers to the right patient based on their needs. This uses the resource scheduling optimization capabilities in our Microsoft Dynamics platform. For your care team leaders trying to manage these resources, they can view and adjust the care team schedules from a streamlined resource management tool. Look, Microsoft has always been a partner-led company, and you can see here just some of the partners we work with today. The Microsoft Cloud for Healthcare continues that tradition and enables those partners to help our customers derive value even more quickly by providing connected healthcare platform underneath them. As our partners continue to build on and extend our core platforms and capabilities, customers will realize the benefits and outcomes that improve the quality of care, increase care team collaboration and communication, and foster actionable insights to drive the ongoing improvement. With that, I'll hand it over to Evan and Christina to explore care team collaboration and virtual health use cases with Microsoft Teams.
Thanks, Tom. It's super exciting to see how the Microsoft Cloud for Healthcare can help provide the better experiences, better insights, and better care. So let's dive deeper into a few areas that Tom mentioned around virtual health and care team collaboration. Christina Baer, GM for Modern Workplace Transformation at Microsoft, is here to tell us a little bit about Microsoft Teams and how it can help you and your organization. Over to you, Christina.
Thank you, Evan. The healthcare industry has seen a massive amount of change in a short period of time. We've heard from customers that the global pandemic has triggered years' worth of digital transformation in a matter of months. Microsoft Teams is revolutionizing the way that care teams collaborate by integrating workflows otherwise fragmented, but in a secure and compliant way. And doing so not only can save time and money, but it can improve patient outcomes. So what is Microsoft Teams? Microsoft Teams is a hub for teamwork, which brings together everything a care team needs: chat and threaded conversations, meetings and video conferencing, and the ability to create and integrate apps and workflows that your business relies on. You can empower your healthcare organization with tailored teams for healthcare, care team collaboration tools, and virtual care capabilities all in one application. And because Microsoft Teams is part of M365, it comes with the enterprise-grade security, compliance, and manageability that you expect and value. Let's start by taking a look at how to get your healthcare organization up and running with a tailored Teams experience. Team templates make it easy to start your new team. Your end users can start collaborating quickly with the right set of channels, tabs, and apps in an experience tailored specifically to their needs, like a hospital or a ward template. And in addition to these templates, IT administrators can tailor a clinician's experience through policy packages. A policy package in Microsoft Teams is a collection of predefined policy settings that you can use to assign users or a set of users who have a similar role in your organization. For example, a nurse could get access to priority notifications and have read receipts turned on by default. Along with the right messaging policy, the nurse can get access to their schedule with ShiftUp and an ability to schedule virtual visits through bookings. These policy packages make it easier to manage the experience for your users based on their role. Teams brings together great video, voice, and chat experiences that work across all devices: mobile, desktop, web, wearables. We understand that clinicians need tools that are as easy to use as consumer chat apps, but with extra security to ensure patient health information is protected. With Microsoft Teams, all of your staff can communicate on one platform with our secure messaging capabilities. Knowing who is on shift and being able to reach the right person at the right time is key to delivering timely patient care. Targeting in Teams allows users to create flexible tags based on a role or a skill and target communication to the right individual or group. Tags can also be powered by shifts, so an ER nurse can message on-call cardiology, and that message will only be delivered to whomever is currently working. Image annotation allows clinicians to take, annotate, and share pictures on a secure and compliant platform so that images are not stored locally on a mobile device. What happens in Teams stays in Teams. And when a message needs to be delivered urgently, a priority notification will ping the recipient every 2 minutes for up to 20 minutes or until the user responds. So lists. Care team collaboration has gotten even easier with lists in Teams, giving the entire care team smart tracking system to huddle and collaborate on their patients. They can run processes like multidisciplinary team meetings, discharge planning, and more. And Task in Teams allows you to assign and track the work that you need to get done across your work streams and organizations, giving clinicians and hospital administrators a powerful tool to manage their responsibilities. They can order it by due date or filter by the ones that are marked important. Approvals. Teams can also bring approvals workflows into one place. The approvals hubs make it easy to request, approve, or reject approvals. It's possible to integrate with e-signature services like Adobe Sign and DocuSign to help you get the signature you need without ever leaving the context of Teams. And shifts. Clinicians' schedules can change week to week. Instead of having to check paper schedules or review multiple systems, clinicians can use Shift to view their schedule, submit time off requests, offer to give or swap a shift, and be instantly notified when their requests are approved by their manager. Shifts can also be integrated with workforce management systems like Amion, Kronos, and Blue Yonder. Last, but certainly not least, is using Microsoft Teams to provide virtual care. In a recent report from Frost & Sullivan, the U.S. telehealth market is forecasted to achieve a 64% growth in 2020. Pre-COVID-19, that forecast was 32%. This is a change we expect to last well beyond COVID. Virtual visits drives cost savings and it improves access to high-quality care for patients. The industry is moving and shifting to a virtual-first strategy. Microsoft is deeply invested in supporting this digital transformation towards virtual healthcare. Part of that telehealth workflow is an ability to easily schedule virtual visits with visibility into providers' calendars and sending customized emails to patients reminding them of when their upcoming appointment is. And what I'm thrilled to announce is that coming soon, we're adding capabilities for SMS notifications for virtual visits. We've also heard that patients don't always want to download a mobile app in order to join a virtual visit from their phone. So we're adding support for mobile web RTC so that patients can one-click join their virtual visit using their mobile browser. No app downloaded needed. It's super easy for patients to meet virtually with their healthcare provider. And clinicians can leverage screen sharing, custom backgrounds, and other great Teams meetings features. All of this in a way that adheres to Microsoft's high standards in cybersecurity and regulatory compliance. Caldwell and Huddersfield NHS Foundation Trust in the United Kingdom made it easier for patients to see consultants and for consultants to provide timely and personalized services. Using Microsoft Teams and Microsoft Bookings, clinicians are booking virtual visits quickly and effectively. Here's a story of how they've been using it in their epilepsy clinic.
Our family's experience and Holly's epilepsy inspired me to ensure that I did the best I can to get Microsoft Teams and the virtual visits out so that no one would have to go through what we went through.
You've got that face-to-face. You can still pick up on your visual clues, just as you could do if they were in a clinic. It enables me to deliver care to that family and to that child at their convenience.
It's hassle-free, it's convenient, it's quick, it's clever, it's effective, it's in high def, it's secure, and it suits modern life.
scheduling capability with Microsoft Bookings in Microsoft Teams is available today. We're continuing to invest in solutions that leverage Teams that meets the unique needs of the healthcare industry. For instance, we're making virtual care even easier with the Microsoft Teams EHR connector. This connector will allow clinicians to launch Teams virtual visits right from Epic's patient and provider portals. We also have a rich set of APIs that allow for Teams integration to other healthcare workflows. St. Luke's is a healthcare provider serving approximately 1 million people across 10 counties in Pennsylvania and New Jersey. In a matter of weeks, St. Luke's transformed the way that they work to deliver patient care through Microsoft Teams, allowing them to continue critical outpatient care while protecting both patients and physicians from COVID-19 exposure and preserving valuable resources like masks and gloves. Devices in patients' rooms are also being used so that providers can engage with infected patients via Microsoft Teams, minimizing their exposure while still allowing for frequent face-to-face connections between patients and caregivers.
For our patients in the COVID-19 pandemic, we didn't have the luxury of time. We knew we needed to act faster. The speed with which the pandemic hit relied on a platform that could work just as fast. And for us, we found that Teams really did help us keep up.
I first became symptomatic with COVID-19 on Saturday, March 28th. I was able to connect with my doctor on Microsoft Teams. So he's like, it's time. My breathing was getting worse. And that's when they transferred me to the ICU about 36 hours after I was admitted to the hospital. Here I am alone. My parents are 800 miles away. My son is home alone. And it really became real that I may not survive this. And it was scary. I was asking the doctors, I'm like, can I not go on the vent?
Intubation's tough. This is a hard thing for patients to survive. We said, what can we do to keep patients off the ventilator? At that point, we had been able to use Teams, gather some of the data. One of the big things that was popping up is a thing called self-proning. Basically, when we had patients to lay on their belly. After several weeks of doing our protocol, we were 6% under the national average. In terms of mortality,
I literally had to think about every single breath that I took. I still had this fear in my head. Was it enough?
Curtis was awesome. He had been in the ICU and then he came to our floor. When a virtual consultation was being set up, the doctor could just connect to Microsoft Teams in the room.
The actual use of Microsoft Teams is tremendously beneficial in my overall care.
I was walking him out of the hospital and Mike, the hospital supervisor, grabbed us at the elevator and said, congratulations, you're the 100th COVID patient to be discharged. It was just a great, great moment for us.
Since being discharged from the hospital after recovering from COVID, I've actually connected with my care team from St. Luke's Anderson.
Hi, Stacy. How you doing?
I'm doing well. It's so good to see you.
It's great to see him happy and healthy and having this virus behind him.
I can definitely attest to the fact that you were a trooper.
I feel good. I'm happy to be alive.
this is about that one person in front of us. To see the improvement, to see them back living their life, makes you want to do more.
People are able to connect with their medical team in a virtual environment. That's one of the steps that we've made, which is great.
Microsoft Teams, in conjunction with the broader Microsoft offering, can help you empower your clinicians to provide the best possible care. Back to you, Evan.
Thanks, Christina. It's awesome to hear how Teams is being used in healthcare and extremely powerful to see how it's being used with our customers. To continue the conversation around Teams in healthcare, Daniel Canning, Director with the Microsoft 365 ecosystem, is here to tell us a little bit about how Teams can be used as a platform for healthcare. Over to you, Daniel.
Microsoft 365 and Teams are not just a set of great services that can solve industry solutions like we've heard from Christina, but it's also a platform that partners and customers can build on to deliver solutions for their customers, our joint customers, really. Beneath all of those services is something we call the Microsoft Graph. Microsoft Graph is a way that we interconnect and index all of the activity that happens across a Microsoft 365 tenant. Everything from groups and people, then files and conversations. And all of those actually have also REST API endpoints, so you can extend them the same way we do from first-party products. We have partners that are already doing this today in healthcare. And they're not just out there building applications for the sake of the extensibility. It's really about driving outcomes. And if you think about the growth that Christina referenced, how much Teams is now being used and adopted across healthcare providers, there really are a lot of ways that we can enhance their investments into what we are also investing in, build upon some of those blocks that Christina's team is building, and upon the Graph API, delivering new value to our customers. A couple of examples I want to highlight. One is we have a partner named Andor, and they are actually creating solutions around adding bots directly into virtual consult visits. So you can imagine in the middle of a consult, you want to bring in some healthcare data from the system of record. They have bots that can contextually bring that directly into the conversation. Another great story is from a partner, Agva, and they actually have an image viewer for diagnostic imaging. And as part of the COVID crisis, actually built an integration where they could have an icon directly within their viewer, and I could click that and send a diagnostic image directly to a Teams channel. They did this because you maybe had radiologists or techs who were no longer in the same room, the same building, and yet they wanted to rapidly collaborate around radiological images. And so they built that integration, have a great customer story about that from the NHS. We also have Divergent, which is a partner that does EHR training and migration services. And they used to spend a lot of time going on site with customers and actually training them on how to use their EHR and onboarding new employees. But of course, they could no longer go on site and visit those providers. So they took all of their knowledge base and insight and created bots and teams to do that same training and support. And they built even integrations so that if that person cannot find what they want within that bot, it can actually drop over to a direct support chat within Teams and even a video meeting. So these are examples, just a couple of them, the way that partners are actually extending Teams using Microsoft Graph, in some cases even using some of the blocks that Christina's team talked about, our first-party investments, all with an eye on driving outcomes for our customers. If you think about healthcare workflows, there's a lot of important experience that happened to the left and the right of the core collaboration. Think about the core collaboration being a meeting or chat. There's a lot of things that happen, think about like a virtual visit. To the left of it, you may have insurance verification, patient onboarding, intake forms. To the right of it, maybe you have satisfaction surveys and notes that have to be taken and added to the EHR. We're happy to announce that we're partnering with Nuance and their Dragon Ambient experience to have that integrate directly into Teams. There's a lot of overhead that exists for clinicians today. After a meeting ends, they have to take those notes, get them sent into the system of record. Work we're doing with Nuance is actually taking that, creating a bot that goes natively directly within Teams, uses the Microsoft Graph to capture the conversation for that, and puts it through healthcare-specific AI and ML to create a note that can go directly back to the system of record. Now, of course, we have great transcription services within Teams as it is, things that you can record meetings and save those. But the uniqueness about this is it's work that's being done that's going against the libraries and AI specifically for healthcare, reducing the burden on the clinician and allowing them to concentrate on their care. Let me go ahead and show you a demo of this, of exactly how this Nuance bot will work within Microsoft Teams. So let's take a look at this demo.
The Nuance Dragon Ambient Experience, DAX, securely captures and contextualizes physician-patient conversations, automatically creating clinical documentation for virtual visits, all within Microsoft Teams. This video shows Nuance DAX integrated into a Microsoft Teams virtual visit between Lucas and his doctor, Dr. Fernandez. The healthcare clinic scheduled an appointment for Lucas and Dr. Fernandez through Microsoft Teams and the Microsoft Bookings app. Lucas received an invite with a link to their virtual visit in Microsoft Teams. The patient joins the visit from their email and is admitted to the lobby. Meanwhile, Dr. Fernandez gets ready for the visit and has her calendar side by side with her chat. When she joins the visit, she sees that Lucas is waiting and admits him into the meeting. When the visit starts, Nuance DAX sends Dr. Fernandez a message. This separate conversation with DAX enables her to start, pause, and resume the recording. When the recording starts, a banner appears to alert the patient that the visit is being recorded.
Have you had this happen before?
During the visit, audio for DAX is securely captured through Microsoft Teams. The entire conversation is recorded and diarized with high accuracy, so nothing is missed, lost, or forgotten. After the visit ends, artificial intelligence automatically converts the conversation into a standardized, structured clinical note that goes through a brief quality review process to check for accuracy, omissions, and appropriateness before being delivered for signature directly into the electronic health record. Nuance DAX for Microsoft Teams promotes a better telehealth workflow experience for both patients and providers by powering virtual visits with clinical documentation that writes itself.
Great. You can see by that demo the way that Nuance's investments integrate natively directly within Teams. We're able to capture that conversation using the Microsoft Graph, use AI that we're developing with Nuance, and take that note and pass it back directly into the system of record. Once again, kind of thinking about that meeting and that as the central experience to providing care or collaborating with a team, we are announcing new work to extend that meeting canvas and bring in data and signals from other systems and have those be a first party directly within the meeting. Adding an app to a meeting, an app that can actually contextualize how people are interacting, whether an attendee, whether they are a presenter, or whether an organizer, and actually having a different experience all directly within the canvas of the meeting. This is a request we have from a lot of customers, and we're excited to open up the canvas of the meeting itself as a place of extensibility. This has a lot of examples that you can see specifically in healthcare. You can see in this screenshot that we have, in this case, you can imagine maybe this is a multidisciplinary team, an interdisciplinary team, or if it was a one-on-one visit, it could just be a virtual consult. And you can actually bring in an application directly into this canvas by using the same navigation that you do today in Teams. And you can see in this example, you have a slightly different experience for each party. So the presenter can see the app differently than the participants. And that app actually knows that natively. We have a lot of great content here at Ignite talking about meetings extension, and we think there's a lot of applicability for healthcare scenarios. One other thing you can do with the Microsoft Graph is maybe you want to be able to create that meeting experience, start meetings, and do that from within your own application. Through the Microsoft Graph, you can actually call the Graph APIs, create meetings, and then you can do different activities with that URL. You can drop it directly within your application. You can send it around an Outlook event. And so to help you kind of accelerate what you can do with the graph and creating meeting links, we've actually open sourced a project that shows you with some sample JavaScript how you can have within your own UI. So imagine this is within your own application. You can have a user sign in, authenticate, select the meeting parameters, hit submit, and then I'll go out and call the Graph API on that tenant and bring back that URL. As I mentioned, that URL, you could do a lot of different things with it. You could create an Outlook event, send it out. You could actually even just drop that within your application on its own. And then later, just as Christina described, people can click to join that experience. They don't have to be licensed for Teams. They don't even have to have the Teams application. They can have very simple join experiences, and you can take advantage of Microsoft Graph to launch that within your own applications. And we have a great accelerator to show you how to do that. So here's a recap of some of these great services we looked at and resources you can find about them. The one thing I want to highlight for sure is go and sign up for the preview of the DAX plus Teams integration. We're excited to bring that broadly to market this fall, as well as learn how to build meetings apps on your own. See some of our great partner apps. I highlighted 3 in this session, but we have a website where we're highlighting all of them. And then additionally, you can see this project for how to go and use the Microsoft Graph to create meetings and add those to your own application. And you can see those are all great examples of how you can drive outcomes using Microsoft Teams and the Graph as a platform. Now back over to you, Evan.
Outstanding work, Daniel. Thanks for sharing the work that's being done around Teams as a platform in healthcare. So to close out this session, we have some great resources for you. First, we've got a link that'll take you to more information on the Microsoft Cloud for Healthcare. We have a site where you can find more information on Teams in healthcare. And finally, you'll find additional resources on here around Teams as a platform in healthcare. In addition to these next steps, we have a ton of great sessions at Ignite. You'll find sessions here around industry, healthcare-specific sessions, and you'll also find other sessions here, say around Azure, or we have a really in-depth session around the Microsoft Cloud for healthcare. And finally, we have the virtual hub. This includes an area for you to go have a conversation around this session, additional content, and more. I want to thank you all for watching, and I really want to thank our speakers for taking the time to review the work that we're doing with Microsoft Teams in healthcare and the Microsoft Cloud for healthcare. Thank you for watching.